everyone. It's Heather Summers from the 18th District. With less than 36 hours to go in our legislative session, I wanted to give you the latest update, and it's actually some good news. We've been able to pass, now out of the Senate, the opiate bill. I call it the opiate aircraft carrier bill. It's a bill that we've been working diligently on in public health in conjunction with the governor's office, and it's made some really great changes that are necessary to help move the needle in the opiate epidemic that we're facing here in Connecticut. I want to thank the Connecticut Hospital Association, the many police officers, the mental health boards and regional RACs that had input in this bill. I'd also like to thank my co-chair, Jonathan Steinberg and Terry Giratana, along with all the people that helped craft this really in-depth piece of legislation. Just a few highlights of the bill to give everyone a perspective on what we'd like to do. It's difficult to do these bills when we are in the financial situation that we are here in Connecticut, so we tried to be able to craft legislation without having any financial impact to the citizens and taxpayers of Connecticut. So what we were able to do is to require physicians now to prescribe opiates electronically. This will help us be able to track the prescriptions and monitor better who's getting what prescriptions. In addition to that, we've come up with a method to have a work group study a method that we can develop a real-time 24-hour-day portal on the public health website that will give clinicians an idea of exactly what beds are available for treatment at the time they become available. In addition to that, we will be helping physicians find easier access to the requirements that are needed to be able to prescribe medications and helping treating an opiate addiction, such as Suboxone and Vivitrol. That will actually be posted also on the public health website. In addition to this, we are looking at things like a standing order at our local pharmacies. So if you are someone who suffers from addiction or has a family member or friend who's suffering for addiction, you can go in and request Narcan. It's basically upon request. So you don't have to have the addiction yourself. It's a standing order. Anyone will have access to it. And that will help those who know someone or suffering from addiction have the availability of having Narcan on demand, which will help in turn save lives. There are many other parts of the bill that are really crafted to help move the needle in opiate addiction. You can go online and look at them. It's bill number 7052, and I'll keep you updated when the governor actually signs this bill into law. But for now, take care, have a good night, and we'll talk to you soon.